Hello, my name is Maria Chaplia. I'm European Affairs Associate at the Consumer Choice Centre, and I'm excited to kick off our new webinar season. The topic we are going to discuss today is beating cancer in the European Union by embracing vaping. Lifestyle freedoms is one of our key policy areas, and so we decided to start our webinar season by talking a bit more about what we do in this field. And our first guest is Michael Landel, a director of the World Vapers Alliance. And so, hello, Michael. Welcome to the show.
Hello. Thank you, Maria, for having me. It's a great pleasure. How are you?
I'm good. Thank you. And how are you?
Fine as well.
Great. So let's start by talking a bit about the World Vapers Alliance and what you do, what's your mission, and maybe have some personal story you would like to share with our listeners. So the floor is yours.
Thank you. In a very short sentence, the World Vapers Alliance is advocating on behalf of passionate vapers around the world to protect our rights to vape. So we were launched in May 2020, so only 5 months ago, and we currently have 17 partner organizations and represent thousands of vapers around the globe. We have 3 main objectives. One is to make our voices heard. 2 is to combat misinformation wherever there it is. And the third one is to ensure regulations are drafted with vapers' interests at heart. So basically, we try to organize a community which allows people and vapers to spread their messages, raise their voices, and tell also politicians their concerns. And when there are bad regulations in the draft or planned, that we can all come together and fight against those regulations and also fight against the misinformation which is out there. For me personally, it's a very, very personal story as well, because a lot of vapers out there have similar stories like I have. So I started smoking when I was 16. Probably the usual thing most smokers do. They think it's cool. We start smoking and then you get addicted and it becomes hard to stop. So I was smoking for 12 years before I decided to quit smoking, because obviously I always knew it was bad. And luckily for me, I somehow found out about vaping and got introduced to it. So I went to the first time in my life to a vape shop around the corner here in Vienna, bought my first vaping device, and I think within 1 week I was able to quit smoking. So it was very amazing experience for me, because I've heard all those stories, how hard it is to quit and what people tried and all patches, gums, and nothing worked. And for me, I just tried the first device, which was luckily vaping, and was able to quit smoking. So I became very passionate about it. And back in that time, I also was working in public policy a lot. I think even at the German Bundestag at this time, and experienced all these new regulations and bureaucratic steps, which made it harder for me to get liquids or e-cigarettes. So I saw that the first shops went down after the online sales ban or when the nicotine amount was regulated. So I felt this regulation in my personal life, and at some point I thought, like, yeah, I want to do something about it, because this innovation of vaping was such an amazing tool for me, and I wanted other people have the same opportunities that I had, and made the decision to get involved into the vaping community, and that's why I also became the director of the World Vapers Alliance. And now it's my full passion to help vapers around the world to ensure those opportunities I had. And with those 3 main areas I already said, I think it will be a tough but also a fun experience in the next few months or years.
Thank you. That's very exciting indeed, and I'm excited to see what comes out of your work. I'm sure it will be a huge success, especially given the number of regulations that keep coming in the European Union. Maybe a bit of an off-topic question. I have many friends who are non-smokers, and I think it's the opinion that vaping isn't very different from conventional smoking. I mean, it sort of is, but many people don't really see the difference. So if you could maybe explain what makes vaping different and how it's reducing this harm from conventional smoking.
I mean, this question actually is basically one of our main objectives, because I think that's has a lot of to do with the misinformation that is out there. I just recently read a study where the majority of Americans, for example, think that vaping is more harmful, or at least as harmful as smoking cigarettes, which is very unfortunate, because for most of the current vapers to switch to vaping from smoking, one of the main reasons for this is to reduce risk. So they knew about it, but a lot of people don't know about it. So basically, in short, the difference is that e-cigarettes contain liquids that are heated and turned into vapor. So there is no tobacco in e-cigarettes, nor tar, and many of the other toxins are not in there as well. So Public Health England already a couple of years ago came to the conclusion that for those reasons, vaping is 95% less harmful than cigarettes. And they started to endorse vaping as an alternative to smoking to current smokers. So even the government there did it. And other countries followed their leads, like Canada, or this summer, New Zealand started a campaign as well to actively endorse current smokers to switch from cigarettes to vaping. So yes, I think you're unfortunately right that there is a lot of misinformation out there, but we do everything we can to combat this misinformation and get the facts straight. But there is work to do, I have to say, yeah.
Yeah, and I guess various branding and marketing bans don't help at all. In light of this, so Europe's Beating Cancer strategy, could you please tell us a bit more? What's it about? I mean, the name speaks for itself. Cancer is a big problem, not just in the European Union, but across the world. And how, in your opinion, can vaping help us combat this issue, and especially, I guess, in the long run?
Yes, I mean, we just launched last week our Back Vaping Beat Cancer campaign, and there our goal is to get vaping as a less harmful alternative to smoking into the Beating Cancer plan. As a short background, the European Commission wants to have a comprehensive plan how to fight and beat cancer within the European Union. And also the European Parliament set up a special committee where the MEPs will provide suggestions to it. And the overall goal is to beat cancer on the continent. And it should entail from diagnosis, prevention to treatment and life of current patients, everything in which comes with the whole topic of cancer. So we are convinced that prevention is a very important part of the whole plan. And we want the EU to have the general principle of the harm reduction in the plan and strongly and actively endorse it, because a lot of countries do that already. And it basically wants to move away from the zero tolerance approach towards a less harmful approach. So as I already said, vaping is 95% less harmful. Nobody argues that there are no risks, but it's 95% less harmful. So it is a very good alternative for people who don't want to or are not able to quit smoking currently. And currently 700,000 people are dying in the European Union with cancer associated to smoking. So it's a very important issue. And we are convinced that we should do everything we can to get this into the plan. And therefore, we started the Back Vaping Beat Cancer campaign. You can find everything on it on worldvapersalliance.com. And we try to gather support from our community to put pressure on politicians to include vaping into the plan, because that is probably a once in a lifetime chance to really fight smoking and obviously the related issue of cancer with smoking. And therefore, it's very important for us to include vaping into the plan.
Absolutely. And in your opinion, maybe there's some relevant data on this, but so we know that vaping can help us beat cancer in the European Union, and the cancer rates are high. Do you have any idea of by how much? I mean, in terms of maybe some vape percentage, by how much the rates we have now because of smoking can be decreased because of vaping?
I mean, as I said, currently there are dying 700,000 people due to smoking on cancer. So basically, in the best case scenario, that's the number. If we can get 700,000 people, or the current smokers, which are 140 million at the moment. So if we can get them to switch to vaping, we will reduce the 700,000 numbers by a lot. But obviously we need the right conditions for that. So as you already mentioned, information is very important, but also access to vaping products is important. That's why we want to have this included as well. So commitment to the concept of harm reduction, but also an explicit inclusion of vaping as one of the most effective tools for people to quit smoking. There are studies out there that say it's almost double as effective compared to nicotine patches or gums. And that's why we want the EU that they actively encourage current smokers to switch to vaping as well. As I said, other countries did that already, so it's not a long shot to do that. It should be quite the logic solution to this huge problem of cancer-related, smoking-related cancer. Sorry. And as I said, also another important part which should be in the plan is the guarantee of access to vaping products. So we see a lot of different kind of regulations or outright bans at the moment around the globe and within the EU as well. So it would be very helpful if the EU would consider that and endorse vaping in there, because otherwise other countries will have bad regulations and very negative consequences.
Right. And I guess one of the unintended consequences of banning vaping, not just banning vaping, but I mean, when it comes to misinformation and various branding and advertising bans, is illicit trades and counterfeiting of various products. And it's obviously an issue everywhere across the world, and consumers don't get access to information about products, so they turn to black markets. And so the Consumer Choice Center recently published a paper on illicit trade, and tobacco counterfeiting was one of the central issues of the paper. And I think that aside from just trying to, I don't know, to make the punishments for counterfeiting harsher or various other ways of tackling the problem, another solution would be embracing this marketing freedom and not banning products so they are legal and consumers can get access to them. And I know that illicit trade is also one of the topics you focus on, right?
Yes, because it's actually even worse than what you described, because with some of the regulations, the regulations themselves create more black markets. So as you correctly said, we don't want to have more black markets because we all know how dangerous they are, and that very, very bad actors are on black markets. So we should do everything we can to avoid black markets and fight black markets. But as you said, advertisement bans or plain packaging regulations create more black markets. But even worse, countries like the Netherlands, for example, they plan an outright ban of flavors in liquids for e-cigarettes, and it negates all the unintended consequences what prohibition always creates, which is if you ban something, the demand is still there. So the majority of vapors are using flavored liquids. We found that at a current research paper I was happily conducting with your colleagues, David Clement and Yael Ossowski. 2/3 of current vapors are using flavors, and most of them use it because they don't want to be reminded of the tobacco taste. So there is a demand for it. It is actually for vapors who use flavored liquids more likely that they can stay away from cigarettes. So there is demand, and if we ban something, this demand will be fulfilled by somebody else. It's basically only three options then the current vapors have. Either they buy somewhere else, which is in the EU or in the United States. If only certain states ban flavors, pretty easy to just cross the border and get your flavored liquids there. But there are two more very severe possible solutions for current flavor users. And the one is going on the black market, just buy it there, and then there is no product quality controls. There will be counterfeits on the black market, as you said. And the third option is also that current vapors will just go back to smoking, which would have a very negative effect on public health. We estimate that only in the US, with an outright flavor ban, about 7.7 million current vapors could go back to smoking. And that is the city of Chicago and LA in population combined. So imagine if those two cities would start smoking right away again. We all know what bad consequences this would have for public health. So we already see smoking rates decreasing, and now those regulations would do exactly the opposite. So, for example, in the Netherlands, we already started a campaign against those plans because, like we said at the beginning, there's a lot of misinformation out there, and those unintended consequences are often negated or not even thought of by politicians. Yeah. So we do everything we can to fight those proposals.
That's an exciting journey. Yes, it's how to yourself too. We have a question from Fabio Fernandez. Which countries are leading the vaping revolution?
I mentioned already a couple of them. Probably everybody knows the UK is very friendly towards vaping, so they actively endorsed as well current smokers to switch to vaping. But this summer we were very happy that New Zealand did the same thing. So they followed the lead, and that showed how important it is that some countries lead the way and show the right way, because on the other side we can also have the other effect. That's why we are so afraid of the flavor ban in the Netherlands, because normally this is a country which has very sensible regulations in consumer products, I would say. So if they go ahead with the flavor ban, it might have a knock-on effect on other countries in the EU. So it's always it can go always in both directions.
Interesting. I just have one more question regarding this misinformation. It's just I understand it's one of the biggest issues when it comes to vaping. Before we move on to another question, so in your campaign, do you focus just on spreading information about vaping products as a safe alternative among smokers, Or do you also target non-smokers so they also know that, I mean, maybe some of their friends and everyone else who are smoking can switch to vaping products?
I mean,
Who's your target
we,
audience in
yeah,
this sense?
as an organization, we represent the consumers of vaping products. So that's pretty straightforward and clear. Obviously, the main target group are current smokers, because the current vapers, on the other hand, almost all of them are former smokers. So we see that vaping is a very effective tool for smokers to quit. So that is the overall goal number one, to get current smokers to switch to vaping. Obviously, if it's just about information, the general public, but more importantly, policymakers are our main target. That's why within the campaign for the European Beating Cancer Plan, we encourage vapers to tell their stories to politicians as well. So they should write their personal success stories to the lawmakers themselves, because sometimes they only see abstract numbers or hear some scary stories on media, but they never hear the vaping community themselves. So that's what we try to do: give vapers a platform and a possibility to raise their voice and to spread their stories, because we hear those stories all the time, and we are fully convinced. I personally have the same story. And probably you at the Consumer Choice Centers listen to the vaping community as well. But unfortunately, the general public and some politicians, they never heard of those stories. So they just think vaping is bad and is the same as normal cigarettes. So those are very important targets as well. And as the more pressure we can get from the streets, I would say, to politicians, the more emails we send to them, the more information we send to them, the better it is, because then they have real life examples in their heads and not just numbers. So that is a main goal of the campaign as well. So on the one hand, we try to get signatures that people support our goal of including vaping, but as a second step, also to get those great stories to the politicians themselves.
Right. So, yeah, I guess using personal stories is one of the best ways to convince someone that your issue matters, because when it gets personal, people can relate on a different level than when you just, I don't know, come to see a politician with a policy paper and all they see are some numbers and policy recommendations. And regarding this.
And I mean,
Oh,
that's what we hear a lot as well. Us too, we hear those stories, but the general consumer or passionate vapor, he feels like he's not heard. And in most of the discussion, that's also true and the case. And that's why your work and our work, I think, is very important also for the vapors themselves, because finally they have a way to express their stories and their way of thinking, and how much this innovation helped. And I think a lot of people just don't realize that yet, what an amazing tool vaping is. And so I'm very glad that we can do this, and I'm very positive that we will gather a lot of these personal questions and get it to the politicians.
Yes, I think it's generally an issue among many consumers and consumer-related topics that consumers just don't feel heard. And I mean, when it comes to everything, sharing economy, free trade, everything. So the Consumer Choice Center, we're also trying to listen to consumers, to raise their voice in the media, and then to bring it up before to politicians. And so we have a question from Bill. What's your personal story with vaping? When did you start? Why? And what do you vape? Yeah, I guess you sort of touched on the question before, but if you would like to elaborate, go ahead.
Of course. Yeah, as I said, I was probably 16, I think, and as so many 16-year-olds, so I thought it's very cool to start smoking. And cigarette after cigarettes came, and at some point I wasn't able to quit anymore without realizing it. So we all know those stories when you start to move in the backyard and hide from your parents and smoke. And from that moment on, I was a smoker, I guess, for 12 years. And then luckily I got introduced to e-cigarettes. To be honest, at the beginning, I didn't really know what it is. I just went to a local vape shop and bought my first device, and within 1 week, I was smoke-free. So it is really an amazing story, and an amazing product because, as I said before, when I heard all those horror stories, how hard it is to quit, I thought like, yeah, we'll never be able to do that. But with vaping, I was able to do it within a week. And as I said already before, that's not just me or me personally. There we heard hundreds or thousands of those stories. That's why I'm so happy to have this role and be so passionate about it, because I think we need to get these stories out, and it's a real life revolution, I would almost call it, because public health agencies around the world try to combat vaping with all kinds of regulations, and then suddenly out of the market and out of the consumers, this new innovation vaping came across. So it's a really consumer-driven innovation, and you can see that it works better than having some top-down regulations or rules or laws or even worse, bans.
Yeah. Yeah, it's generally better to let people choose for themselves and to decide what's best for them. We are all in favor of personal responsibility and freedom, of course, especially when it comes to lifestyle. So we have many questions. So a question from David Clements. Many legislators are concerned with youth vaping. How do we balance giving adults more harm reduction choices while ensuring that youth don't start vaping?
Obviously, that's a big concern and an important issue, but it is not related to our campaign, for example, for the EU beating cancer plan, because in the EU it's already forbidden for under 18-year-olds to vape and to smoke as well. So it's more a question of law enforcement. We need to have and come up with smarter ways to enforce the existing laws, rather than banning each part of the whole vaping experience or each vaping product, or regulate it and make it way harder for current smokers and adults and adult vapers to switch or to keep vaping and not fall back to cigarettes. So that's obviously always you need to find a balance, but the law is pretty strict, actually, and pretty clear who is allowed to vape and who is not. So we need to find ways how to enforce it, but it's definitely the wrong way to ban, for example, flavors for adults, because it's an instrumental part why a lot of vapers are able to stay away from cigarettes. So we need better ways to enforce the law, but no more regulations for adults, because also, as you said, Maria, it's a choice for adults, and not policymakers should make this choice for them.
Yes, and I think it's you mentioned that it's hard to sort of enforce laws, and so that we prevent young people from smoking, but we also sort of want the law to be universal. Yeah, I guess there's many issues on that front, you've mentioned many times that vaping is safer than conventional tobacco products, but could you maybe provide an overview to our listeners of what studies or what research could point them out to see why vaping is actually safer than tobacco products?
I mean, as I said, the main study was conducted by Public Health England. They, the first time, said it's 95% less harmful. And basically, there are a lot of other studies out there, also from the University of Wellington in New Zealand, which came to the same conclusion. A lot of these studies come to the same conclusion. Obviously, there are hundreds of studies out there about different topics. So we more or less follow the approach and trust the governmental studies. So if a government and country and whole countries follow the lead and trust those studies, we did the same, and that's why we are also saying that following the approach of the UK would be sensible, because those are the most reliable studies.
Fair. So we have relevant studies, we have research, we have everything. And when it comes to, trying to convince policymakers why vaping is actually safer, is it the problem? Is the problem that they don't believe the research, or is the problem that they are not aware of the research? What do you think?
It's hard. That's hard to say. It's probably both. I mean, in general, you know, the concept of bootleggers and Baptists. So there's always one group which is in favor of some kind of regulation because they profit themselves out of it, and the others, they do it from a moral perspective. So I would say with politicians, it's kind of hard to generalize it. But the issue number one is probably misinformation, I would say. As I said, they read newspapers and only read these horror stories. We saw it with the Ivali case, where those lung damages were associated with vaping at the beginning, and obviously it turned out that it had nothing to do with it, because it was illegal products which were used. So yes, that is misinformation, but also a part of them are very the Baptists, like, I'm not even sure what do you call that in English. They, from a moral perspective, they just don't want to see people using nicotine in any way, so they follow a zero approach, zero tolerance approach. So they say either you quit or you have no other options. As I said before, we follow the harm reduction concept, because it's better to give people a less harmful alternative than no alternative, which actually should be quite logical, I would say. But a lot of people don't accept this approach, unfortunately, because they just want to eradicate every nicotine containing product. But yeah, the main problem, I think, is misinformation, and that's why we have this as one of our main 3 goals, actually, in our mission statement, and we do everything we can to combat this misinformation.
Yeah, it's quite a challenge, I guess. We can tell. So we have a question from Samira. How is the WVA different from other organizations? There's so many out there who are advocating for vaping or other forms of alternatives to smoking.
I didn't really hear the first part.
How is the WVA different from other organizations? I mean, there's so many out there advocating for vaping or other forms of alternatives to smoking. So what makes you unique?
Basically, we try, as I said, to combine those 3 goals into one, and we support our partner organizations, but also individual vapers with the main strengths we have. And so we support our partners with our broad political and media network to get their voices out there. Our community building experience and grassroots experience is also very helpful, because, as I said, vapers sometimes feel a bit even lonely, I would say. So we try to build a community of vapers, and we are right in the process of it. So we already have thousands of subscribers, and also a little bit to unite the voices. So there are a lot of organizations out there, and we try to bring them together, get the best practice strategies of each other to the world out there, basically to learn from each other and to be a central platform for all of this.
Interesting. Yeah, that has been very helpful. I mean, I for one got a great overview of what you're doing and your mission. And probably one last question, just to wrap it up. So, could you please come up with this elevator pitch on how the mission of the World Vapers Alliance and what you do, your mission statement? How does it fit into the EU beating cancer strategy? Just, I don't know, just like this. So that I'm convinced, me as a politician who has no idea what vaping is, but I want to beat cancer, so I'm convinced that vaping is the right way forward.
I mean, yeah, as I already stated a little bit before, vaping is 95% less harmful compared to smoking. So if we know that 700,000 people die in the European Union due to smoking related cancer, it should be our number one goal to reduce this number. And one of the most effective way of getting people away from smoking is vaping. So it would be very important to have vaping included in the EU beating cancer plan, and also to endorse actually current vapers to switch. So that would be a landmark issue for the EU, and should be, and everybody who wants to beat cancer should back vaping.
That's very convincing. So we have two more questions, actually. So a question from Rob. How can people on the ground do something on a local level to convince politicians to stay away from regulating their vape devices and juices?
Obviously, the first and most important point is to raise your voice wherever you can, and in what way you can. One way is to become a member of the World Vapers Alliance. That's very easy on our website, and we will provide everybody with all the resources we have and all the tools we have to make a difference in the community. Obviously, there are also a lot of great partner organizations in a lot of countries. You can find all of them at our website as well. They do amazing work on the ground, and that's what I said already. We try to bring all those resources together and be a central platform for all of this, and where everybody can find all the information, the tools, the techniques they need to make a difference in their community. Obviously, one step for the EU Beating Cancer Plan is to sign the petition on worldvapersalliance.com. You find the general EU petition, and for certain countries, we translated the petition, so it's very easy to sign up. And in best case scenario, if you want to do me a favor in the second step, you also send your local representative or a member of European Parliament a message about your vape journey, I would say, to put pressure on them, but also to just let them know what an amazing innovation vaping is.
Yeah, that's very exciting indeed. And I guess there will be, as you said, vapers, as many consumers who are left out. They feel like often, especially when it comes to their freedoms, that they have to do something, but often they don't know what to do. So they just keep staying silent, and the government then just continues tramping on their freedoms. We have one more question, but you sort of touched on this before about underage vaping and its possible negative health effects, and whether you think vaping should be allowed for everyone.
If it's meant for everyone, for kids, then
it's sort of, do you think that vaping should be allowed for everyone? So I'm a 12-year-old, or 14-year-old. Should it be allowed to vape? Or I guess that was the question about it.
Yeah, no, I think the current laws for underage people or the youth are good. But the problem is the enforcement of them. As I said, we have the laws, we just need to enforce it, which is obviously a tough ask to do. So we need smarter ways to enforce it than just have outright bans. The problem I see is more that a lot of people are using this argument to ban things they don't actually want to have adults as well. So as I said before, with the flavor bans, they just most of those people they use it as a front to the youth argument, because we see most youth young people in surveys, they don't start because of the flavor or something like that. The vast majority starts out of curiosity. So outlawing curiosity is hard, but to say that's a reason for outlawing flavors has a very detrimental effect on the public health, because then actually the current vapors and hopefully future vapors who are current smokers are not able to use these products anymore, even though they are very instrumental in the journey away from cigarettes. So we are back basically at the unintended consequences. So in short, we need strict laws for the youth, yes, obviously, but also then good enforcement. But we can't have less choice and less products for adults who think it's a very instrumental part for them staying away of cigarettes.
Yeah, and we have one more question. Thank you very much for the questions, by the way. What are the different vape products and what's in vape juice or e-liquid?
There are hundreds of different products out there. I'm a huge fan of the open system things because basically you can use from every industry, every product. But obviously there are many other players out there and many other ways as well. Also with harm reduction, you have hundreds of different products. But as I said, we don't really advocate those kind of things. We just want to have an open system for adults, and everybody should choose what works best for them. For me, it was vaping, and for many other people, it does as well. So our main focus are consumers and the affordability and availability of harm reduction tools, including vaping, obviously.
Okay, yeah, that's. I mean, of course, I guess you could talk for hours about all those vape products. I mean, the mission of the WVA is very exciting, and I really hope you will be able to succeed in everything you aspire to, and especially in helping the European Union beat cancer. So we don't have any other questions. So I guess we'll probably wrap it up. Do you have something to say in conclusion, like maybe a call to action why vapers who are watching us should join the WVA right now?
As I said, if they feel they are not heard, their voices are not heard, sign up for the World Vapers Alliance. We will do everything that we can to help to get your voices out there and be heard, and get it into the parliaments around the world, fight all these bad regulations. So first step is to become a member of the World Vapers Alliance. You find all the details and information at worldvapersalliance.com. And for the European vapers, it would be very helpful and good for us that the more signatures we get from our petitions. You'll find this also on our website. So sign up and raise your voices wherever you can.
Exciting. So to all vapers out there who are listening to us, join the World Vapers Alliance today. And as a quick reminder, so Michael mentions the vape flavors paper. I mentioned the illicit traits paper. You can find them on our website. So it's consumerchoicecenter.org. And thank you very much for being with us. Thank you, Michael, for coming on. It's been a very in-depth conversation about vaping. I feel much more confident talking to my friends who smoke and to my friends who vape about this now.
Thank you for having me, Maria.
Thank you.